Hey, welcome back, everybody. It's time once again for the weekly journey we call Living Hope, a show designed to provide hope, inspiration, and education for those living with pancreatic cancer, sharing the real life stories of those really affected by this deadly disease and how they deal with it on a daily basis, along with resources like those we're going to bring you today, right, Roberta?
Yeah, I hope so. I hope I know we have some great information, so we're happy to share that. Today I have Debbie Soldano. She is a nurse practitioner with over 25 years of experience in nursing and healthcare, particularly in caring for patients with pancreatic cancer. Today we're going to find out more about the Pancreatic Cancer Prevention Clinic, programs for pancreatic cancer prevention, as well as some valuable advice to help us maintain our health and well-being, especially during the summer and being out in the sun. And what role does this chemo and radiation play in us needing to protect our skins and stuff. So
Before anybody starts sending us nasty notices, for some reason we can't get the Zoom insert into the video, so you'll hear her off camera, but unfortunately we can't see her today here.
wow, well, there you go. You can just hear us today. I know.
That's okay.
Thank you, Debbie, for going with the flow, and happy to see you. I'm happy to see you, and I'm sorry nobody else can see you, but I'm happy to see you, and just happy to have you here. So, can you share a little bit about your background and what led you to specialize in pancreatic cancer?
Sure. Well, thank you first for having me. I appreciate the opportunity to speak about all things pancreas. Um, I I just think a long, long time ago, I always had a desire to be a nurse. I wanted to help people, and that's really I can't say anything other than that. That's really what led me to nursing. So when I got into nursing, I actually wanted to be um, I wanted to deliver babies. And then when I got into it, I worked on a cancer floor, like as a rotation, and I absolutely loved it. I Some things I don't have problems talking about, certain things, and so I think I was really uniquely placed in that position, and it's just been a passion for the rest of my career. I became an oncology nurse. I started working at UC Cincinnati and University of Cincinnati with Dr. Lowy, Andrew Lowy, who's actually the division head at the Moores Cancer Center. And I've been very blessed to have such a great mentor and partner. And we dealt in GI cancer. So that's what I've done my entire career.
And did
Mostly
you
with,
say Cincinnati? Is that where you were from?
that's where we started out. Yep.
Okay. And there's another cancer center, though, now where?
And so then Dr. Lowy was recruited to University of San Diego, and he asked me would I consider going and doing what we did in Cincinnati and San Diego. So, I mean, it took me a long time to decide to do that, but then I said yes, and we started the program, lots of programs at UC San Diego, including the Pancreatic Cancer Prevention Program.
Okay. So there's two of them, the Morris Center. Morris Center.
Well, the Pancreatic Cancer Prevention Clinic is within the Moores Cancer Center.
Got it. Okay. All
I'm
right.
sorry, I didn't mean to confuse you about saying University of Cincinnati. That's where I started off.
And how do we spell Morris, just so everybody, if they want to go look it up?
That is the Rebecca and John Moores Cancer Center. It's Moores. The Moores Cancer Center in La Jolla, California.
Okay. All right. We got that out of the way. Carry on.
Thank you. Thank you. Um, I know you have a bit of a connection with pancreatic cancer itself. You lost your sister. Are you comfortable telling us a little bit about her journey and your journey with her on that?
Um, I, yes, but forgive me if my voice cracks or anything. I always do have a little bit of difficulty talking about her. But my sister was diagnosed with pancreas cancer. I was actually in Italy. There's something about Italy because my brother also was killed when I was in Italy, so I'm not even sure if I should go there anymore. But my other sister called me and said my sister was in the hospital with some type of heart condition. And I was like, what? And so I was coming home the next day. So anyway, while she was there, apparently she had had a CT scan a couple months before and had something that they were watching. So while she was in the hospital, they did a biopsy and we found out that she had pancreas cancer. It was pretty devastating. So I really relate to patients I just know how they feel. It's like a punch in the gut and the wind just gets knocked right out of you. And it's pretty devastating.
Yeah, it is, and I appreciate you sharing that. I know it's difficult. I don't know if you know my history or not, but I've lost my mother, father, grandmother, and uncle to it before I was diagnosed. So that phrase you use, getting the punch in the stomach, like getting the wind knocked out of you, most definitely that's the way it feels. And I don't want to ask you too many questions. I want you to be comfortable. So thank you
I'm
for sharing that.
comfortable, but thank you. That's the best way I can describe how somebody feels, and I can totally relate to that, which I think helps me, when I'm dealing with my pancreas cancer patients, just trying to get them, just guiding them through the process.
Was your sister able to do any treatment or have surgery, or was it too quick?
She did do treatment and she had a really good response, and she was going to come to the University of San Diego for treatment. And Dr. Lowy, and I have to say Dr. Murphy, who's head of radiation oncology, Dr. Lowy is head, I think I already told you that, of our surgical oncology division. They were great in helping me and helping guide me with my sister. And she was going to actually come to UCSD for a clinical trial, and she called me a couple of days before that and said she was having some back pain or something. I was like, oh God. And I said, I'm sorry, but if you were my patient, it was very difficult. It was different having your sister as the patient, because my sister never thought anything was wrong with her. That's just how she was. And I said, I would, if you were my patient, I'd be telling you to go to the ER because something's not right. This isn't right for you to be having that pain. It was new. So anyway, she ended up taking my advice, and she had a CT scan, and the disease had advanced. So she ended up not coming. She wasn't eligible for the trial.
Well, thank you for sharing. And again, I appreciate it. I know it's difficult. And now to get a little bit lighter subject is
Okay.
with summer being here, what are some important sun tips for pancreatic cancer patients?
Well, first I want to say that people that have pancreas cancer or any type of cancer, they should actually follow kind of the same thing that people would do normally. So I'm talking about staying out of the sun between the hours. Some people say 10 to 4, 10 to 2 is kind of what I've always been told. That's when the UVA and the UVB rays are stronger. But what I will say, so they should apply sunscreen, at least 30 SPF. They should wear a hat. They should wear sunglasses. I mean, typically you should probably try to stay out of the sun between those hours when the sun is going to be the most devastating to them. But what I would like to say about particularly patients, pancreas cancer patients, just depending on if they're getting treated, if they're getting radiation, those things make them more susceptible to getting sunburn, heat stroke, or dehydration. And in my mind, I would think that dehydration would probably be like maybe the number one thing on that list. And that's just because, and even people who have just had surgery, a lot of times their bowels are adjusting to the new surgery. And so they can have diarrhea, especially from pancreatic insufficiency. And then some people, when they're getting treatment, chemotherapy treatment, they can also have diarrhea. So what happens when you have diarrhea? You're losing a lot of fluids and electrolytes out your bottom. So you go out into the sun, you're going to rapidly become dehydrated. And, some symptoms of dehydration, people always think it's thirst, but really by the time you're thirsty, you're probably already dehydrated. And it's very easy to do. This is one thing I've seen repeatedly in my pancreas cancer patients, that they get dehydrated very quickly and very easily. And some of those symptoms, they can have a headache, they can become dizzy, they can have a decrease. They're not going to the bathroom as frequently. They're not peeing as often, and their urine is dark. So those are some of the symptoms of dehydration. So I would just caution people to drink. All these things maybe sound redundant, but they're really specifically for people who are in treatment, or even radiation will make your skin more sensitive to sunburn. So again, I would tell them to hydrate, 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 hydrate. And I have a little tip on that point. If you drink one glass of water and you start at 8 a.m., like 8 ounces of water, by 5 o'clock, you'll have drinking 8 cups of water, which is what you're supposed to drink. So
And
it's hard to
that'll
monitor.
keep us, yeah, hydrated. Even like I said, I know it's different with when you're doing chemotherapy and radiation, because with one of the chemo drugs I was using, that's what I was told to be very, very careful with the sun, because I mean the drug itself gave you kind of a rash and made you actually look like you were already burnt. So that was one of the things they always advise. But it's so hard because you're feeling good, and especially if you're an outdoorsy type of person. What are some things that you can really, I mean, I know long sleeves, but are there anything else that you can be doing to kind of help protect yourself?
Well, besides the things that we talked about, putting on sunscreen and actually covering up, is actually very good, wearing your sunglasses and stuff. But you can kind of try to do your activities around those times when the sun is at its hottest, between 10 and 2. So maybe if you're doing something outside, maybe you can do it in the morning, like go for a walk in the morning before the sun's rays become, too bad, or maybe later on in the evening after kind of that danger or risk is gone. But I wanted to share this story to you because it just popped into my head. I gave a talk one time for the American Cancer Society. And what I wanted to express, and these were all men that worked outside in the hot heat and stuff, construction workers, which this is why I think this is so hilarious. So I had this picture, and I had to get special permission to use this picture, but it was a picture of these people on the first railroad ever, and all the men they all had long sleeves on. I mean, this was in the summertime, and they were wearing hats and stuff. And I was like, what does anybody notice about this picture? And this one gentleman spoke. And he told me the whole history of the railroad, the first day of these railroads. And I was like, well, that's actually, you're correct what you just said, but that's not what I was going for. So I thought that was funny.
So you never got your answer, I take it then.
Well, I had to bring home the point myself, but the point is that you can be out in the sun, but even back in, 50, 70 years ago, we covered up when we were out in the sun. And I think, and I don't know, I don't know how to answer the question. Is it more prevalent today, or do we just have better diagnostics that we can diagnose, skin cancers of all kind? But I just think it's interesting that we used to cover up more, and now we're not. So take from that what you will.
Thank you. I want to get back to the hydration part because, there, besides water, are there other things you can drink or do to, make sure that you're hydrated?
Water gets pretty boring, which I totally understand. You can do some things like coconut water actually has a little bit of coconut oil in it. That's very hydrating. Gatorade can replace your electrolytes. There's tons of things that you can do. I'm used to telling my patients, because after surgery, they have a hard time eating. I always tell them to do smoothies. So you can do the same thing with, which would count as hydration. Like you could do something like freeze your watermelon in the refrigerator, and then maybe put that in the blender. Watermelon and cucumbers are very hydrating because they have a high water content. So you could shake it up a little bit to help make it more interesting so that you're not just drinking boring water, even though I love water. Cold with ice cubes.
There you go. The colder, the better, right?
Well, not for patients who were
I
getting
know.
treatment.
Yes.
I'm sorry, but not for them because they're very sensitive to hot and cold. But there's other things that you can drink besides water.
And I think you can, like you say, put the I mean, I like putting the cucumber, even just, squeezing a little bit of lemon in the water. I don't know if that's good or not, but I do, and I like that
Is
flavor.
good. Lemon and basil water, lemon and cucumbers. I make pitchers of water, and that's what I put that in there, and it's so good. It's very refreshing.
Yes, it is. Are there any foods or anything that you should kind of avoid during the summer that might counter react what you're trying to do as far as hydrating?
Boy, that's a great question. I, when I'm dealing with my patients, I don't like to restrict their food intake because a lot of them are losing weight, and I don't think this is the time to go on a diet. But I will tell you one thing about foods that you're eating. In the summer, especially, people are usually eating more fruits and vegetables. I just make sure that you wash those really good and just sufficiently wash them, and then in a colander or something. That would be really important. I can't think of something that I would tell somebody not to eat, but I think it's important to wash those fruits and vegetables.
That just brought a question, and I'm not sure if you can answer it, and I hope I'm not putting you on the spot. But the difference
No.
between
A lot of things I don't know.
that's the way all of us, and this is how we learn, right?
Yes.
I don't want to say like regular fruit and vegetables, but that versus organic fruits and vegetables.
I would still, are you asking me? I would still watch those organic fruits and vegetables. I don't know if that's the question. Is it better to eat organic? I mean, by definition, organic is not supposed to have pesticides and things on it. So, but I would still wash them.
Still wash those, even yeah. Because I
Yes.
was told like if you're like an orange, because you're peeling it, that you may not necessarily wash it, but you still recommend that would be probably a better
But
idea.
Yes, so this is interesting because me and my daughter had, she goes, I don't remember you washing vegetables when we were little. I said, yes, I did. But, and then I started, then I actually read about this, about like, what's the harm, especially for like watermelon, let's say. It's got a very thick skin on it, but it does say that there can still be viruses and things on it. I think that that's probably really a low risk, but they still recommended washing off all your fruits and vegetables. So I would do it. But
Yeah.
there's no harm in that, right?
No, it doesn't hurt anything. In fact, you brought up a good point because what one of my I think nurses brought up to me is okay, maybe it's organic, but then when you cut through it, if there is still something like you say, something through it, you're going to go through the fruit or vegetable, whatever it is. So just to be safe, it's better just to go ahead and wash.
As a surgical nurse, I can tell you that that's true because when you cut on someone's skin, we always clean it off first. We try to sterilize it before we cut on it, right? Because when you put that knife in there, you're just gonna, anything that's on there, you're gonna inject it right into the skin, the bacteria or something. So that's a good analogy.
Very
Thank
true.
you.
Yeah, I hadn't thought of that. It's a very good one. So I think, I think we've probably covered as much as we can as far as what to do as far as summer protection, unless there's something you can think of that really we missed or didn't talk about.
I just think the most important thing again is that people get dehydrated really quickly, and that's including after surgery, when they're getting treatment. So I think it's really important to stay hydrated, and you do that the best way that you can. You're supposed to drink 6 to 10 cups of fluids daily, which I know is hard. I will tell my surgical patients because I don't want them drinking a ton of water because they won't be able to eat, and they have to eat after surgery. So this is a very fine balance. But in general, I would just make sure that they stay hydrated and just beware. You can be in the sun. Actually, I'm a big believer. I think the sun is good for you. I think God gave us fresh, sunshine, grass outside. I think it's very good to be in nature.
Well, they say that's the best way to get your vitamin D. I don't know if that's true or not, but that's a good way to get
20
vitamin D.
minutes of sun.
Yeah.
Yes, 20 minutes of sun. I actually just read something about melatonin, which I did not know is you produce it in your body, but the sun helps you to produce that. I was like, wow, that's interesting because 50, 70 years ago, people used to spend 55% of their time outdoors. Guess how much we spend now outdoors?
I'm
Just the average person.
I'm afraid to even guess. I know it's very little when you see all the, the laptops, the iPads, the phones, everything.
Yes.
Everybody's doing stuff inside on that, the game. So I'm afraid
That's
to.
exactly right. It's 10%. And I just read that it was a study that came out of Australia because in a lot of ways are ahead of us on sun stuff. But I thought that was really interesting. So I think it's really good to go put your feet in the grass and have the sun shine on you. Cover up because you'll still get some sun from that. But I think that you need that to produce, vitamin D and also melatonin.
Yeah. Yeah, I can remember as a kid getting on my bike in the morning and not coming home until the street light goes on, right? So,
Yes, we have to recapture some of those things from the past, I think, that to help make us healthy again.
yeah, I think so. And just to get out. I mean, I don't know. I don't get the whole thing
Very
being
good for your mind. I always
right.
tell my patients to breathe, and I know, and I don't even want it to sound cavalier, but I just think when you get the wind knocked out of you, you lose your breath, right?
Yes.
You have to breathe. You get oxygen to your brain so that you can think clearly and so that you can calm down.
Calm
So it's
down.
very important.
Yes.
Yes,
And make the best decisions for yourself that you can.
exactly. You
Very
can't
good.
do it when your mind is in chaos, and that's a fact.
Very true. So I would like to move on and talk about the Pancreatic Cancer Prevention Clinic and its
Yes.
primary objectives. Can you tell us what it is exactly? I mean, we hear a lot about it, but a lot of us don't know what it is. So if you could kind of tune us in there.
Well, so a lot of people who maybe have a relative that has pancreas cancer, they're concerned and like, hey, what can we do to prevent pancreas cancer? And obviously, we haven't been good about that. You can get testing, but it's really not the yield. I know this sounds bad, but they do all these things scientifically. The yield that you would get from getting a CT scan with somebody with pancreas cancer is incredibly low for the cost that you're going to spend trying to, figure out if somebody has pancreas cancer. And so I would say that our testing is not all that great for it, although there are so many exciting things coming down the pike. But how this clinic came to be, so we would have a lot of patients, and because Dr. Lowy, I call him the pancreas cancer guru, because this is all we have done. He has done his entire career is a lot of pancreatic cancer research. But so a lot of people will come to see us, and they have, let's say, they have a cyst, or they have an IPMN, that stands for intrapapillary mucinous neoplasm. A lot of people are like, oh my gosh, if they hear anything wrong with their pancreas, they want it out. But sometimes these things don't have to be removed, especially if you find something and it's very small. And the way that it looks on a CT scan, sometimes you can discern this is probably nothing. But of course, we're going to watch it. So who is going to watch it? And I don't mean that facetiously. So when you're at a cancer center, you have three disciplines. You have surgical oncology, you have medical oncology, and you have radiation oncology. And so in some ways, the surgeons probably would follow this, but there's a lot of people with these potentially benign, and sometimes they can be cancerous. Um, these tumors or these cysts in their pancreas. And of course, patients are rightfully scared of that. And so we thought there was a big need for somebody to screen these patients and like, what can we do? So we got genetics involved. So genetics at the Moores Cancer Center. And we have gastroenterology involved, the GI guys, because a lot of times if you have something in your pancreas and there's a mass in there, and especially if it looks suspicious, right? Or sometimes, they'll do it because it's there and it's a certain size. But a lot of times, I would say the gold standard for diet, well, this is the gold standard for dying people with pancreas cancer, diagnosing, would be to do an endoscopic ultrasound. So they go in through the mouth and it's an upper endoscopy, that's its other name, and they can actually biopsy that mass in the pancreas. So all these people became part of the discipline so that we could have and the surgeons, so it's the surgeons and the GI guys, those are the people who see our patients in the pancreas cancer prevention clinic. We have a wonderful nurse who was running that clinic. Her name is Emma Vale. I don't know if, I'll just ask for forgiveness later. And then with Dr. Simeone coming aboard to the cancer center, she's the new director of the Moores Cancer Center. She will also she'll be running that clinic, and she has a PROCEED trial, which is for people who have a family history of pancreas cancer. I don't know, I might have ran all around that, which I tend to do, but that's how it came up to be, because let's just say somebody had a cyst in their pancreas and they're scared about it. Okay, this is the first time we've ever seen it. We don't know how that is going to behave, right? We don't know anything about what we're seeing on film. So that person, we would have them come back, especially if we don't think it's suspicious, maybe 3 months, maybe 6 months, and see what happens. Like if that gets bigger, then that's a little more concerning. There's some things that you can see on a CT scan. I'm not a radiologist, I should tell you that right now. But sometimes if it's nodular or it looks like it has a solid component to that cyst, then we're a little more concerned about it being a cancer, a potential cancer, even if it's surrounded in a cyst. So if we send them to the Pancreas Cancer Prevention Clinic, usually they'll see a GI guy and he will recommend doing an endoscopy, and he'll do it and he'll get a biopsy. Or sometimes when you see the surgeon, they say, this doesn't look too concerning if this is the second or third or fourth, because sometimes we'll get patients that come for a second opinion when they have like a cyst. And you say, okay, well, let's just follow this, and they'll follow it. It's kind of abstract now as to whether we follow it for 5 years. I actually think they're currently discussing that. I could be wrong about that, because at some point you want to end that, because it's very stressful for the patients.
Right.
But at some point it's like, okay, this is benign. It hasn't changed in, 5 years. So unless you're symptomatic with something else, it's probably okay to not follow that.
You mentioned it doesn't look suspicious. I mean, what does that mean? I mean, if it doesn't look suspicious, what is it? Can you describe that a little bit?
I just did. So when you're looking at and again, I'm not a radiologist, but I just happen to know this because I'm in the field. So if somebody has it looks cystic, and the radiologist will read that as a cyst on the CT scan. But sometimes if that cyst is connected to a main duct branch to the pancreas, it might be an IPMN. And again, that's interpapillary mucinous neoplasm. So sometimes I call that the disease that I call it 50-50. This is not even medical, but sometimes those can go on to become cancerous. But a lot of times they're benign. So that's one of the things that you kind of have to keep an eye on those. And again, if they start to get bigger, or you see a mass on on a CT scan and it has some solid component to it, that's never good. That's very suspicious. And I could tell you a real quick story about a gentleman who had a cystic mass. He was sent to us. And then when COVID hit, he said that his GI guy told him that it was okay, that it was probably nothing. And I told him, actually, I really bugged him because I've got this weird thing about taking care of people, even if they don't want to take care of themselves. I said, I am so sorry to bother you. And I know that you don't want to do this, but I would strongly encourage you to get an endoscopy, because you're not one of those people who just has a cyst. You're one of those people who has a nodular component to your cyst, or a solid component. And they'll read that. It says mixed solid cystic component. Those are more concerning than just a cyst. So I said, with all due respect to your GI guy, if you have pancreas cancer, it's not his problem. Now it's your problem. I go, don't you want to know? You should get this test. So anyway, not that I want to talk people into stuff, but I think I did talk him. And he went and he had the test and he had a pancreas cancer. So this is what I'm saying. Some of these things, and you can tell by the report, a trained person that's in pancreas cancer can tell that's one of the things that looks suspicious. So we would call that suspicious. That's not something you would watch. You would want to biopsy that.
Right. Well, thank you. And I'm sorry, but like out of time, and I have so much more I would like to talk about. I know I would really love to have you come back, because like I said, there's more I would really like to talk about, but I do want to thank you,
Roberta.
We appreciate you, your dedication to improving patient care and outcomes and being the beacon of hope. So thank you so much for what you've done, the years you've dedicated, and I really do appreciate it. And as long as you speak my name, I shall live forever, is dedicated to Tammy Knapp, who was a nurse and served in the Veterans Administration and also a member of the military. She passed away at the young age of 52. So thank you.
Thank you, Roberta, for saying that. Oh, I was.
Well, there you have it. One more reason to tune in each and every time to Living Hope, a weekly journey designed to provide hope, inspiration, and education for those living with pancreatic cancer. Sharing the real-life stories of those really affected and the real research being done on a daily basis. And if there's something you'd like to share, please contact us here at the station, or if anyone you know needs help like right away, lots of organizations will give you one. We mentioned here, letswinpc.org, letswinpc.org. And other than that, we hope that you'll share this information with others and come back and join us on this weekly journey. Right here in Orange County's only community radio station, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.